Good morning, everyone. First of all, thank you for giving me chance to introduce myself. My name is J. Sunita. I'm from Hyderabad, and welcome to my presentation. Now I'm going to present you few important questions of previous AIMS paper, and let's start the presentation. And only 10 questions. I'll let you know only 10 questions, important questions in that paper, and let's see the first question here. The first question is apex of the heart is formed mostly by the answer is left ventricle, and here also you can see the diagram of heart and the position of the apex. Okay, so most of the apex at the left ventricle side, right? Okay, then next, second question. Following, which is the largest cranial nerve? Do you know which is the largest cranial? Already I have written answer there. What is the fifth cranial? And do you know what is the name of this fifth cranial nerve? Here you can see the pairs of cranial nerves. How many pairs? 12 pairs of cranial nerves present. And in that, the first one olfactory nerve, optic nerve, oculomotor nerve. Fourth one trochlear nerve. Fifth trigeminal. Sixth abducens nerve. Seventh cranial facial nerve. Eighth vestibulo-ocular nerve. Ninth glossopharyngeal. Okay, and up to 12 I have written here. So in that, in this all the cranial nerves, the fifth is the largest cranial nerve. Okay, just you remember, trigeminal nerve is the largest cranial nerve. Then the fourth question, the third question, tarsals of the ankles are the examples of. So nothing but in the ankle joint, so whatever the tarsals present, so these tarsals are examples of long bones, short bones, or flat bones. Okay, the answer is the tarsals are the examples of short bones. Okay, the next fourth question, how many bones are present in the lower extremities? Any guess? Okay, the answer is 60 bones. Okay, let's show you the answer, but I didn't write here, but the answer is 60. Okay, so here two femur, two patella, two fibula, two tibia. uh, each extremities contain 7 tarsals, each extremities contain 5 metatarsals, phalanges, right? Okay, so just you do just you double it, 7 into 2, 5 into 2, and 14 into 2, and together you can add and you will get the total 60. Okay, then next, fifth question. So here approximate maximum air volume in the lungs for the normal adult. So nothing but how much the normal adult has lungs has the capacity, how much air it can hold. Okay, the adult lung capacity is almost 6000 ml, nothing but 6 liters. So to get normally we can call total lung capacity. The total lung capacity of normal adult is 6 liters. Okay, the next, sixth question. Carpo-metacarpal joint is an example of carpo-metacarpals. So in hands we can see these joints: carpo, metacarpals, carpal metacarpals, and this carpo-metacarpal joint is an example of which joint? The answer is saddle joint. Okay, actually what is a saddle joint? Saddle joint is also has the capacity for few movements like flexion, extension, abduction, and adduction. The next one, seventh question. See the seventh question. Which of the following layers of adrenal gland secrete glucocorticoids? And all we know that parts of adrenal gland, and it contains two parts, adrenal medulla and adrenal cortex. And here the layers of this adrenal cortex are, it contains 3 layers: zona glomerulosa, zona fasciculata, zona reticularis. Zona glomerulosa secrete mineralocorticoids, zona fasciculata secrete glucocorticoids, and zona reticularis secrete androgens. So here the question is, what is that? Which of the following layer adrenal gland secrete glucocorticoids? The answer is zona fasciculata. Just remember GM, general manager. Okay, GM. Okay, glomerulosa secrete mineralocorticoids and fasciculata secrete glucocorticoids. Okay, fg you can remember, right? The next example of ball and socket joint. The best example of ball and socket joint is hip joint. Okay, and few examples also you can see. Skull joint we can call the immovable joint, thumb joint, saddle joint, elbow joint you can also call the hinge joint. Next, here one more another name for, okay, another name for clotting factor 2 is prothrombin. Okay, here you can see the 13 clotting factors. How many clotting factors are present in our body? 13 clotting factors are present. Here you see the first clotting factor is fibrinogen, second prothrombin, third tissue thromboplastin, fourth calcium ions, fifth level factor, seventh stable factor, eighth anti-hemophilic factor, and ninth Christmas factor, or it is also we can also call that plasma thromboplastin component, and 10th start power factor, and 11 plasma thromboplastin accident, and 12 Hegman factor, and 13 fibrin stabilizing factor. Okay, so in that second factor is also called the prothrombin. Okay, so already, so the important clotting factors I highlighted. So some questions whatever I studied, so most of the questions came from these clotting factors only. So that's why I highlighted these three clotting factors, right? Okay, then next question. Next question. Hmm. Which quadricep? Okay, which of the following quadricep femoris helps in flexion of the thigh? Nothing but which muscle is helping our thigh for flexion? And the answer is rectus femoris. Rectus femoris is a muscle of the thigh, and which help for knee flexion and hip flexion. Okay, the next.